Hello all, this is Dr. Dheeraj Masapu. I am a senior consultant in the field of neuroanesthesiology, and today I would like to discuss a very interesting topic. So, will doctors' earnings decrease in the upcoming years? So, basically this survey I conducted in my channel and you can see here. So, just how many of you think that doctors' earnings will decrease in the upcoming 10 years by 2034 is the question I asked, but 65% of the people told that doctors' earnings will decrease. So whether it is right or wrong, we are going to analyze in this particular video with numbers, statistics and logics. That's how I talk, right? So in this particular video, what I am going to cover is, I am going to it is very clear that number of seats are increasing. I will show you the exact number, but so that's the supply, right? I'll talk about the demand now. So I'll talk about the healthcare infra development which is happening in India and which is going to happen in future. And also I'm going to talk about the health insurance penetration, the exact numbers in India and how it is going to impact the demand part. And also the government schemes which are coming in India and how are they going to impact the demand part. And also the how do you actually increase revenues of the hospital by improving quality and all those aspects I would like to talk. And also artificial intelligence, when it is coming into healthcare, by 10 years it will come, right? So when it is coming, how is it going to impact the doctor's earnings, whether it is going to increase or decrease is what I am going to cover in this particular presentation. So that my agenda is, you need to get an equilibrium between demand and supply. So how do you do that is what I am going to tell you. So let me begin with how many colleges are there in India. There are roughly 700 colleges in India which are producing MBBS students. So like 225 new colleges have been added in the last 5 years, mainly in Telangana, Tamil Nadu and Uttar Pradesh. Okay. So total of near to 1 lakh MBBS students are coming out every year. That is a huge number. So looking at this number, most of you are thinking that it will get saturated. So let us see what will happen now. And the National Medical NMC has reported that at present there are around 13 lakh doctors in India. These are the stats of 2022. So what I did is, if you add 2 lakhs to that, it will be around 15 lakh medical working people who are registered in the NMC body. Unregistered and so many other Ayush and so many other people are also practicing in India, but in NMC registry 15 lakh people would be there at present. 15 lakh is a pretty big number, right? So what is this number, more or less? It's usually decided by the WHO. So WHO actually recommends a number of 1:1000. Like for every 1000 patients you need one doctor, and we are exactly at present in that situation now. So like 140 crores, right, is the Indian population, roughly 140 to 145, and we are around 14 to 15 lakh doctors. It will come to around one doctor for every 1000 population. That's a pretty decent, we reached the WHO target, congratulations. So but how is it going to affect our incomes in future is what I'm going to tell you now. Okay, so there are a set of things that you need to understand to basically understand the demand part. Supply part I already told you. Supply is like, enough supply is happening and the government's agenda is to increase enough more supply because they want us to go to rural places and serve everyone. That's a very good thought process. I really appreciate it, but so at the same time we should also balance our incomes, right? So that is how is that going to get affected. So first you need to understand the healthcare infra development of India. So what is happening in India, because the lot of foreign investment is coming into India in different hospitals, like Manipal is supported by TEMIS and so many like Medicover is some other country, and like every hospital is having some kind of foreign investment linked to that, and they are actually pumping a lot of money into India. So when even Aster also has a Middle East segment, now they're separated, but that's a different story. So what I'm trying to tell is, a lot of foreign investments are coming into healthcare, that in India. Why do you think so? The reason is, they are looking at a lot of business potential in the healthcare segment in India. Okay, they will do all the calculations and maths, right? So their calculations and math will be correct. So this is the latest news. Indian hospital chains are trying to actually expand. Okay, and I've gone more into details of this particular article. What they're saying is, more than making 2,000 bedded hospital, they're planning at making 250, 300 bedded hospitals and more in number in different parts of cities, and they're planning to enter the tier 2 cities also in future. The reason what they're quoting is, what happens is if you make 1,000 or 2,000 bed hospital in a big city, the traffic will be there, right? So people from one part of the city cannot actually go to other part of the city. So that's why they're planning to cover all the areas with small hospitals. That is their agenda. When they make more hospitals, what happens? For us, advantage is that we will get more jobs. Okay. So according to this particular article, what they're telling is India has 1.3 beds per 1,000 people, which is well below the WHO recommended 3 per 1,000. Okay, so India will need around 2.4 million additional beds in future. Okay, and India is going to become a developed country, right, in another 5 to 10 years. So we will reach this target. So we will reach another 2.4 million additional beds. So a lot of hospitals are going to come. Don't worry. Okay, so this is a healthcare infra development which is going to happen in India. And not only that, a lot of hospitals are planning to expand. So Aster DM has recently announced that they're going to expand another 1,700 beds in the next 3 years. And then hospitals like Max, Rainbow, Medicare and KIMS and Jupiter Lifeline hospitals are going to expand even more, like thousands and thousands of beds are going to come. When so many beds are coming, you need so many doctors. Okay, for example, a 300 bed hospital, if they're planning to make it, I know roughly, it needs around 200 to 300 doctors to work in that particular hospital. So like that, when they increase the number of beds, minimum 1:1 doctor requirement also will increase at different levels, from MBBS doctor to super specialist in different levels. The requirement of doctors will increase. So hope you understood that healthcare infra development is booming, going to boom in future. Okay, the next part of the presentation would be the healthcare insurance penetration. So what happened in India is approximately 37% of Indians are covered in health insurance schemes. This is way below compared to other countries. You can see other countries like USA, France, Germany, they're like 10 times more, covered than us. 10 times, that's like almost 90 to 100% coverage will be there in those countries. So what we need to do is, we seen in COVID times, right, without insurance it became a big problem. So we need to increase insurance penetration of India. That will happen with economy development and education level. Obviously everybody will take insurance, and when insurance penetration increases, what happens is the number of patients coming to hospitals will exponentially increase. And in future, insurance will start actually putting rules and regulations for the hospitals, like these are the minimum requirements, these are the minimum. For example, diabetes needs endocrinologist only, not a fellowship person. So like these kind of rules and regulations they would be setting up. So if you have better qualifications and super specialties, you will get benefited when insurance penetration increases. But overall, when in the context of this video, insurance penetrations will increase the number of patients coming to the hospitals. So that is the reason all the healthcare funding is increasing, a lot of bed expansion is happening. So all the big hospitals and big investors are not fools. They have a strong calculation and they are looking potential in India. That is why they are coming, right? Okay, so then the next aspect would be coming to the retirement of the people. See, you are only seeing how many people are getting added to the society or added to the doctors list, but you are not looking at people who are retiring, because there are a lot of people who are going to retire also, right? See, when people are being born, some people are dying. Like the same way, when some people are added to the society of doctors, some people exit also. Please consider. So this is a particular article which has come. Indian retirement population to rise in future. Nearly 40% of people are going to retire because they're going to become older in future. So when they retire, the supply part will automatically decrease. Okay, so you don't have to really worry, because there is a balance happening in the world. It's not only addition into that common pool, there is some exit also. Don't relax. So the number of doctors may increase, but at the same time exit also would be happening. And this I explained in my previous video. Just briefly I would like to explain. What happens is, the present we are actually located at this part of the curve, and our population is around roughly 130 to 140 crores, but we are talking about 2034, right? So by the time our population will be 140 to 150 crores. So population is also increasing, right? That too already explained. When population increases and the geriatric patients increase, geriatric medicine, surgical oncology and neuro, spine surgery, joint replacement, anesthesia, intensive care, endocrinology, kidney specializations like urology, nephrology, gastro like med gastro and surgical gastro, transplantation, so many specialties will flourish in future. So this I already explained in my previous video. And the amount of young people in the country and affordable people will increase. So sports injuries and psychiatric addiction specialties, cosmetic and bariatric specializations, sleep specialization, and andrology and sexual health, infertility medicine will boom in future. So these are the areas. You can go into my video which I have done on, will be the highest paid by 2034. I explained everything in detail. Let us not go into more detail of this. Let's come back to the topic. And the next important thing which would happen in future is, with our work pattern and increasing number of work hours. In UK actually they work for 3 to 4 days and they take off for 1 to 2 days. In India we work for all the 6 days, in some places 7 days. Obviously it will lead to physician burnout. Okay, so in future, after 5 to 10 years, what happens is, physicians won't be ready to work for 7 days in a week and 6 days in a week. They will tell we will work for 4-5 days. And the most important change which would happen in every specialty is a shift based work. So they will tell we will work in shifts. We will work for a particular morning shift, afternoon shift, and evening shift. Okay, so we give me fixed hours, for example 40 hours or 45 hours in a week. We will work for this number of hours and this shift. So the advantage is, when you adopt a shift based work in healthcare in all the specialties, the number of doctors will automatically increase, the requirement of doctors will increase, so the demand will increase. So this is going to happen in future. Nobody is going to work all the time in the hospitals. People will want to have work-life balance, so they will go into shift-based panel. They'll insist the management on having. They might even cut down their salary, and they might tell that you cut down our salaries, or at least we will have a work-life balance in future. This is how the future of Indian healthcare would be. I'm telling you, mark my words. And then rural setups. This is another area which would actually be pushed by the government. So government health schemes are actually trying to make the healthcare affordable, right? A lot of Ayushman schemes are coming. They will come in future. Nobody can stop them. So how they would be focusing is, they might not actually control the healthcare in cities, because metros are already established by private healthcare. So they cannot maybe compete with private healthcare, because private healthcare will become more affordable and high quality care. So they might focus on the rural areas. So you can see an image here. This is how I'm envisioning in future. This is a village and a very high quality center a government might set up under the leadership of Modi. So if this kind of center is there in my village, I would actually go and work there, and you can develop healthcare in that particular area. But the thing is, how to actually sustain the revenues, how to actually do all those things need to be calculated by the government. If it's funded by the government, the operating costs can be cut down, and we can actually run it in this level in future. And again, I'm thinking these kind of things might come up in 5 to 7 years or 10 years down the line, and in rural areas also you'll have high quality centers like this, and many doctors would actually go, so the requirement of doctors will increase, and the pay would be maintained. And next is quality of care in the hospital. So high quality care is required in the hospitals. Many people wouldn't be knowing this. So when your patient goes home with a very satisfied feeling, what happens is, he'll recommend another patient. So your hospital revenue will increase. When your hospital revenues increase, then they will take more people and increase salaries of doctors. Salaries won't come down in the future. So focus on quality of care. So this is a very important aspect that most of the young doctors need to understand, that your patient's experience need to be controlled. So he should go with a very good experience. Let it be anything concerned to your field. For anesthesia it will be pain. For surgical gastro it will be maybe constipation or some ileus or something. Control the experience, and then what happens is, they will refer more patients and your hospital revenues increase, and what happens is, the more jobs will be created in future. Got it right? So it's in your hands now. And coming to artificial intelligence, so AI is going to harm us is what many people think. AI is going to replace radiology, many people are thinking like that. Nothing is going to happen like that. AI is actually going to help us. So AI is going to make precision medicine very precise. It's called precision medicine. So what happens is, it will tailor the needs of medicines. Maybe by the time I go to the intensive care, AI might actually make a list of all the medicines which need to be given to that particular patient, considering his allergies, age, weight, genomics, pharmacogenetics, and it gives me a list. So it makes my job easy, right? And it makes more precise, and outcomes will get better, patient experience gets better, he'll refer more patients. Simple. And medical imaging, like radiology will get very precise and accurate with the advent of AI, and radiologists can actually give a very best result. The errors will come down, and AI might pick up the clinical history and imaging history, and it will guide the radiologist and make his job easy and efficient and best results. So that is another way. And also AI can help in robotics. So a lot of robotic surgeries are coming up right in future. So AI will actually help in assisting the surgeon with giving a kind of like Iron Man movie is on AI. It will be talking like Jarvis will be talking to the surgeon. In that way, maybe a Jarvis will come in future which will be talking to the surgeon, and then it will be helping the surgeon in operating. Maybe we don't know. Things might help go like that, and finally the quality of care will improve and patient satisfaction should improve. That should be your end point, not AI or robot or anything. Okay, AI. So AI overall, my conclusion is that it will improve the patient outcome. It will reduce the cost of operation. So with AI, you can actually make all those rural setups what I have shown you. So AI will actually increase our jobs. If you decrease operating cost, the hospital management will be okay, will have some money to take more doctors, right? So using AI, you can decrease operating costs and you can actually help in getting more jobs, and you can transform the medical practice. So I feel AI will help us. This area, everyone will have their own opinions, but I'm very AI enthusiast, and I feel that AI will actually help us. So now I hope you understood. I'll try to explain here. So now the supply part, we know that it has increased, but the demand part also is increasing because healthcare infra is improving, insurance penetration is increasing, people are retiring, right? So and immigration also is happening. Some people are going to other countries to settle. So and then number of people in India will pretty much it will be maintained constant in future, and affordable young people are increasing. I've shown you the graph, right? Demographics, young people number is increasing and affordable people are increasing. So that also will increase the demand in certain areas, which I explained in the video. And shift based work is what you need to enforce, and you will enforce in future if you want work life balance, and that will actually need more people in future. Increasing the quality of care is what should be your focus, and then artificial intelligence will help you. Don't worry with that. Okay, so only thing I would like you to know is the pyramid of success. So what happens is the healthcare will operate in a pyramid way. So very few doctors will reach the top of the pyramid, and they will take 50 to 70% of the total salaries. And every sector is like that. Like if you take Google, Sundar Pichai will take the maximum salary. If you take Microsoft, Satya Nadella will take the maximum salary. It will be like that. So you try to reach the topmost point. For that, you need to put in a lot of effort, and you need to put in hard work. So, and then you need to have a strategy. You need to have all this, a good CV, strategy, branding, so many things are there. That's a totally separate topic we need to discuss. So if you have all that, you will reach the top of the pyramid, and that is what is required. So even if whatever I have told is not happening, if you would implement all these things, you will reach top of the pyramid, and even if there are 1,000 doctors, you will earn a very good income in future. Okay, thank you guys for following the video, and join the channel. And I'm doing a members exclusive video now, which is coming, an interview with my friend who is there in Middle East, and he's going to tell how his experience has been there since many years in this country. That is not going to come in public, and because we didn't want to put that in public, we'll keep that only for my members. And we want to we're going to talk about few things which we really don't want to put out in public, so we'll keep only for members. At present 8 members are there. I'll announce their names also in future, and their photos and everything, and so we'll do that video next. Thank you guys, and as usual, Dr. Dheeraj Mahasappu logging off. Roger that.